Dr. Christy Hall, and Christy is a member of graduate faculty. Some of you have classes with her this semester. She joined our faculty in August, almost immediately after completing her PhD from UTK. Those events were very, very close. So Christy is a recent graduate of the University of Tennessee, Knoxville, and her dissertation focused on the role of staff nurses as preceptors. She did a qualitative study and found some really interesting findings, and she's in the process of writing a manuscript of those findings. So I would, without further ado, Dr. Hall.
Good morning. Good morning.
Good morning.
Like Dr. Raymond said, I am a fairly recent graduate. It took me 5 years to get my PhD. I had this grand idea that I was going to just move through smoothly and that it was going to take me 3 years and I was going to graduate in 2012 and everything would just mesh right into my life the way that my life was going as a full-time faculty member and a mom and a wife and a sister. And let me tell you something. That's not what doctoral education does. I ended up going from part-time student to quarter-time student, if that's even a thing. I'm glad to see this number of students who are continuing your education to become doctorally prepared nurses because the profession needs this. Okay, I started out as an associate degree nurse, and then I got a baccalaureate degree, and then I got a master's degree, and then I finally said, is there anything else that I could do? Because I'm a glutton for punishment. I've been a registered nurse for 20 years, and my board certification is through the ANCC in medical surgical nursing because that's my true passion. I'm a bedside nurse at heart. It's my favorite thing to do. Here I am, and it's been a wonderful first semester, and I'm looking forward to another good semester here with you fine people. So today I'm going to talk to you guys about the patient perspectives of bed baths and moving from the idea and how I got the idea into making this a grant proposal, which I never thought would happen. So the idea actually came to me last semester. I was teaching undergraduate nursing students, brand new, first semester in, and they were in their Nursing 2020 class. This is one of the very first courses that these students take here at ETSU during their first semester of nursing school. It's the Introduction to Professional Nursing. So in that course, we talk about the history of nursing. We talk about legal aspects of nursing. We talk about ethical components of nursing. And then we also talk about theory, which undergraduate students say, oh my God, I don't need to know anything about theory. I don't need to know anything about research. But theory and evidence-based practice are very important to nursing, and I know that you all know that. So I just happen to be the lucky faculty person who I love theory. Love it, love it, love it. I know, just shoot me now, right? But I love theory. And so I said, I'll teach that. I'll teach theory, I'll teach evidence-based practice because I love it. And I think I can make it exciting for the students. So I went into class, and basically what I had done was I provided these students with some information about current evidence-based changes that we've seen. We've all heard the term, in here we've all heard the term sacred cows. We know what sacred cows are. In nursing, we still have them. But here recently, as we've seen this paradigm shift moving from sacred cows into evidence-based nursing practice, right? We say, we want to go to the evidence. What does the evidence say? Why are we doing this? Why are we still doing this way? So I wanted to kind of bring that home for these students. So I provided them with some information, and there were several good things out there. There was information out there about checking the residual on PEG tube feedings and NG feedings. Information about how to confirm or validate placement of a nasogastric tube. We know that that's been, changed very recently. And there were other information out there. There's other information out there about bed baths. And one thing that we've seen recently, probably within the past maybe 5 years in nursing, especially in the hospital setting, is we've seen this transition from traditional bed baths where we were giving baths with soap and water and basins to these prepackaged warmed wipes. Are you all seeing that or familiar with this in your setting or your practice area? Anyway, if not, you know that it's out there, right? Okay, so there was lots of information. So I provided these research articles to the students, and we were going over them in class, and
I really thought, oh, this is exciting because they're seeing what a research project looks like, and they're seeing the outcomes of the research project and all this wonderful fun stuff. And then I started to think as I taught this class, you know, the undergraduate program here at East Tennessee State has just undergone some major curricular revisions. And along with that came some course names, some changes to course names. And one of the course names, well, several of the courses are focused on patient-centered care. And in fact, some of the courses here in the undergraduate program are now called Patient-Centered Care 1, Patient-Centered Care 2. So my initial connection was thinking, okay, so we as nurses and nursing faculty and educators are calling these courses and calling what we're doing patient-centered care. But what I was not finding was the patient-centeredness with regard to this particular practice change. And I thought, that's pretty interesting. So, being the researcher and the nurse scientist and excited about that kind of stuff, I thought, oh, Lord, eureka. You know, I thought, this is wonderful. So, something was missing. Something was missing from that piece of our practice. Just related to that bed bathing. Something was missing. Guess what it was? You got it. It was the patient. The patient. And I thought, are we really practicing what we're preaching here? We're calling it patient-centered care, but is it really patient-centered care? So, okay, you see this term, you see all this right here, and see this little arrow? I'm not going to say it right now, but just keep this term in mind. It's going to come back to us in just a minute, okay? It'll come back here at the end of the presentation. Y'all know who that is, right? That man in the bed there, house? Okay. All right, so I ran back to my office after class, and I said, where's the beef? Do you all remember that from way back in the day? Where's the beef? So my initial literature review, I had to go find the beef. I had to find what was out there. And so I started doing this literature search and thinking, oh my gosh, what am I going to find? Well, let me tell you, there's really not that much information out there that's related to bed bathing in general. There really isn't. There are some articles that I found that went back as far as the late 80s, early 90s, and then there was almost like a gap of several years where nothing much was published, and then we've started to see this phenomenon come back into the literature because of those wipes, and because those wipes and the way that they are looking at and researching these wipes with regard to infection control and skin integrity and those kinds of things. So we are starting to see more literature right now. But most of the information that I found, current information that I found, is related to infection control. I was able to locate 11 research articles, actual research articles, and most of these examined, most of them were comparison studies that examined a bag bath versus a traditional basin, water and, soap and water. Also the chlorhexidine gluconate impregnated wipes versus non-chlorhexidine gluconate impregnated wipes. And then other studies that examined whether or not CHG liquid was as effective versus the impregnated wipes. So a lot of information about infection control, which is wonderful. There was a little tiny bit of information about other things. Skin integrity and bathing, the effects that bathing has on skin integrity, looking at these wipes and that kind of thing. Showers versus traditional bed baths, so getting a patient into the shower as opposed to providing them a traditional bath, a basin. And then other alternative methods as opposed to the wipes themselves. Something called the soft towel method, which I had not heard of, where towels are actually used, they're warmed up, and they're already, they've already, got the soap and things on there, but all the towels are laid on the patient, and the patient is just, it's almost like a warm massage, if you will. So there were some additional methods that were discussed in the literature. So I completely excluded the anecdotal pieces looking at this particular proposal. I wanted just what the research said, okay? So out of the total 20 research articles that I examined, only 4 of those considered patient satisfaction as a piece of the research. 3 of those were quantitative studies. 1 of those was a mixed method study, meaning that it had that quantitative and then also a qualitative piece. Okay? All of those studies were international. There were 0 here in the United States. There was one from, and Dinesha, is Dinesha in here? There she is. She's kind of helped me with this piece of the literature review. And so she had sent me an article that I did not find. One of the articles that I didn't see, one of those was from Nigeria. There was one from Sweden, one from Canada, and one from somewhere else that I can't remember right off the top of my head. But there was 0 from here in the U.S., 0. 3 studies had a qualitative component, 2 mixed methods, and 1 was a secondary data analysis. And out of those 3 studies that had a qualitative component, only 1 of those considered the patient's perception of the type of bath used. 1. Just 1. So that was the research findings. That was kind of what I found and how I had pieced it out. Over on the right-hand side, there were just some interesting findings that I put up here I thought was, just interesting. There was an article by Popovich et al. 2009 that reported that they had implemented a practice change moving from a traditional bed bath into CHG wipes. And this is their verbatim words right here. They did this as a clinical management decision without research input. Yeah. So, I was thinking, oh my God, how dare they, right? As we start getting this knowledge, we look at things and we go, how dare they not consider the research? How dare they do that? Additional study, Collier, Sullivan, and Cadman, 2010. This study examined, again, the bed bath. They were looking at bed bath and the wipes, but they were focused on the nurse's perspective. The nurse's satisfaction. How time efficient was it for the nurses? What was their experience like? And this particular study had a qualitative piece that was included, and they conducted focus groups with nurses. And so in this article, as I was reading, there was a little box. You know how we learn as we go through that you can't ignore the boxes because that's where some of the good data is. So I found this little box, and in that box were these questions that they had posed to the focus group of nurses. And one of the questions that they had asked the nurses, what was the experience like for the patient? Excuse me? I just about fell out of my chair. I was going, oh my God, what are we doing here? So, what's going on here? Who should we ask what the experience was like for the patient? Yeah, you think the patient might be able to tell us what the experience was like? But what they did was they said, what was the experience like for the patient? Well, that's your perspective, your perception, and we all know about those, right? This same study, it was also interesting to note that this very same study found that nurses who had this, they were looking at ICU nurses, found that nurses with greater than 5 years of ICU experience believed that provision of a bed bath was an advanced skill. An advanced skill. And that the value of a bed bath was not shared by their junior colleagues, those nurses who had less than 5 years of experience. Pretty interesting, I thought. Would you ever think that bed bathing would be considered an advanced skill? It really kind of is if you think about it, all the good things and information we can get from it. So I thought this is all great. And then I kind of had this look that this baby had, like, what is going on? Where's the patient in all this? So that was my next step. After reviewing the literature, I said, this is wonderful, but what do patients think about bed baths? There's nothing there. It's missing. So I looked like the baby. Then I had this guy's look because I said, OMG, okay? Oh my gosh, what am I going to do? Because this has nothing to do with my dissertation. And I had this grand idea that, your dissertation just kind of sets your path. It becomes your whole life. And believe, you have to love what you're doing. You have to love what you're studying, absolutely. But then you get out of school and you start realizing there's other things out here that I might find interesting, okay? And now I know what to do with it. So I was kind of like, could I do this? Do I dare step out of my comfort zone of nursing education and even think about it? So, being a novice faculty in the graduate program and being a novice researcher, I took the idea to colleagues. So I said, help me. We discussed what we know, what we had from the literature, and we also discussed what we didn't know. And then we said, is it worth it? This is that proverbial so what in doctoral education. Have y'all heard that yet in doctoral ed? Okay, so you want to study what the effect of a particular flower has on a patient's well-being and spirituality. So what? We get that, okay? We always think our research is just the greatest stuff since sliced bread. But then you have to actually say, is this really going to be worth it to the profession? The time, the money, the energy that's invested there. So what we discussed is that nursing is uniquely patient-centered. We are the unique profession to provide this type of patient-centered care, regardless of our setting. We knew that through anecdotal experiences, meaning I have taken undergraduate students into the clinical setting for 12 years, and just being there in the hospital settings with patients and with students, when certain types of bathing products are used on a patient, you start to hear things like, I don't feel clean. I haven't had a bath. Dad hasn't had a bath in a week, and we've been here this long. So I was thinking, this is pretty interesting stuff. So anecdotally, I thought, this may be something we need to kind of explore a little bit further. Not just anecdotally, but if you go back and you look at the Institute of Medicine and their wonderful report, I believe 2001, Dr. Diffendorfer, you'll have to correct me if that date's wrong, Crossing the Quality Chasm. And then also some other federal agencies that you want to look at, the Agency for Healthcare Research and Quality. Both of these agencies have indicated that patient preferences, values, and autonomy should be considered when we make healthcare decisions and practice changes. So if I took that and I looked back and said, we've got research out there that actually, these people actually said this is a clinical decision that was made without research input. We're not really doing what we've been directed to do, even by the federal government. And at least they got that right? They got that part right. And then we said, hey, nursing, what we have done is we have implemented practice changes that have changed the paradigm of how we provide patient care without considering patient values. That's incongruent with what we do as nurses. That is incongruent with what our professional obligations are. So I said, this is great. I'm going to do this, okay? So I went from that look, ran back to my office, and was so excited because what I knew then was I had this post-collegial validation. There's a new fancy term, right? That's just a fancy way of saying I've talked to my colleagues and they've built me up and they say, go for it, okay? Post-collegial validation. I knew that there had been no studies that were done on this. I was going to be the first. There was a huge gap in the literature, and I knew it. And this was a new area of nursing research that relates to everyday clinical practice, because this is something that staff and RNs, we do it every day. And so then I said, whatever, I've got this. I totally know what I'm doing now, right? I've got it. Whatever. And then I said, how am I actually going to do it? Okay, now I know I can do it. So I had my question, and my question was, what are the patient experiences of receiving a bed bath in an acute care setting? Because we know that research questions have to kind of be narrowed down. We can't go out and save the world with one study, right? We have to start kind of small. I also knew my method. Remember that the question, your research question, drives the method. And so my method, because there wasn't any information there, I knew that this would be a qualitative exploratory study that was driven by an interpretive paradigm. And that's what I want. I want the patient's perspective. I want to know what their perception of bed bathing is. So I took it back and I said, okay, this is what I'm thinking. And my colleague said, sounds great. Now you're going to have to find a way to pay for it. And I said, you mean this stuff costs money? And they said, yeah, it costs money, unless you want to pay for it out of your pocket. Well, I didn't want to do that. So they said, you have to look for grants. And they said, start small, because as a new faculty on tenure track, we got to start getting that funding, or at least applying. And we can't go out and immediately apply for these $10 million grants. Can you imagine a $10 million grant on bed bathing? People would think I've lost my mind. So I said, okay, I'll start small. How about a maximum of $1,500 just to kind of support the project? And Dr. Weierbach had said, hey, this RDC grant. And Dr. Raymond said, yeah, that sounds great. And Dr. Diffenderfer said, yeah, that's wonderful. Let's go for it. You can do it. And they said, you need this for tenure. And I said, show me the money. Show me the money. Then they told me I had 3 weeks to get the thing done, and I looked like that. Okay? And that's what happens. They say, oh my God, these calls come out, and you've got 2 to 3 weeks to get this thing written, and you say, okay, what? Yeah. So then I went into looking like this lady over here. Help me, save me, because I've never written a grant before. Sure, in doctoral education, you have the grant writing seminars and the grant writing things, and you think, oh, this is wonderful, I can do that. Then you sit down with it and you look at the papers and you say, oh my God, I can't do this. There's no way. What do these people want? So the grant proposal process for me was fast and furious, and it usually is my understanding. That's what I'm finding out very, very rapidly, that this is a fast and furious process. You have to hit the ground running. There's no time to dilly-dally. You must follow the directions to a T, and if they say draw a heart over here around this letter, that's what you do, okay? So you have to be a detail-oriented person. Edit, 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 edit. I took a version that I thought was the most glorious thing that I'd written in ages back to my colleagues. And let me tell you something. You know how your papers come back? That's how this came back to me. I was like, God, y'all are brutal. Yeah, no, they weren't. They're not brutal. I'm just kidding. But it's necessary to edit, edit, edit. And I have several versions of that grant. Just this little small one, because of the editing. This also forced me to flesh out my research process, which seemed kind of backwards to me, because as I had moved through my doctoral program, we went through very systematically. You get your question, you do the lit review, you write the paper, you then say, I'm going to move into my methods, and da-da-da-da-da. Then when you get everything ready, like the research flyer and the informed consent and all that stuff, you get all those pieces ready before you write the grant. No, this was backwards for me. So I had to write the grant and kind of flesh things out a little early on, and without actually having all the pieces to the puzzle ready to go. So the other thing that is important is that you need to seek help when you need it, which for me was, of course, editing. It's imperative that you always get an editor. Take it to your colleagues, let them help you, because there are very tight character and word counts that must be maintained on these types of documents. And then the budgeting piece. Okay, look, I'm not a math genius. I mean, I can balance my checkbook, but when it came to actually writing the budget justification, I'd never really done that for a grant, and so I needed help there, and I was able to find that. So seek those resources when they're available. The result of this particular process for me has been that I submitted it online by the deadline, which was December the 19th. I was here 2 days out of the week that was right before Christmas, cursing in my office, saying, I want to go home and be with my family, and here I am working on this stupid grant, And I said, okay, well, I'm here, I may as well just get the thing done. So I did it, submitted it, and then the paper copy was printed and signed. They sent it to me in a PDF. I printed it out, signed it, and I took it right downstairs to Vicki Martha down in the Center for Nursing Research before Christmas break, and boy, I had a weight lifted off of me so I could enjoy Christmas. Then Mr. Bill Hartley hand-delivered this signed product over to the RDC office, which before the deadline, which was just this past January the 9th. And so I'm currently awaiting word from the RDC office as to whether or not this project has been funded. Now, I've made a personal commitment to myself and to the profession that regardless of whether this particular project gets funded, I'm going to do the study. I feel like it's important and I want to do it. It's something I want to do. So because of that, I'm working on the IRB piece now. So it's kind of backwards, for me. So more of the so, what, and future goals. For me, this addresses a really significant gap that's related to fundamental nursing practices. It will be absolutely essential that because there is no literature out there that I disseminate these findings rapidly. So whether that means, the publication, hopefully some presentations will come out of it as well. There's potential for replication for larger, more diverse studies because, you always want to try to increase the generalizability of your study findings. And then looking for more of that, show me the money, right? More money, 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 money. And then because of this, I also have some ideas for bathing product development that I hope, fingers crossed, at some point in my research trajectory, I can't do all this in a week. I mean, this is a years-long process that could lead to potential partnerships with colleagues in other colleges across campus and maybe some patent applications and submissions. So that would be nice. So takeaways from this presentation are that big ideas can hit you at any time, so you need to be prepared. You can have more than one area of interest because I love nursing education, but this has really kind of become a passion for me. And you all can do this after your dissertation or your capstone, okay? We don't want you to have more than one area of interest right now. Number 3, academic writing and grant writing are not the same thing. You have to learn to turn those things on a dime based on whatever it is that you're trying to apply for. Seek out and take advantage of those people who are willing to help you and those who have the expertise to do that. You have to try. The worst that they can tell you is no. I always go into submissions, whether it's manuscript submission or presentation submission or grant proposal, I always go in expecting that I'm going to get rejected. And then I'm never disappointed. Might be pleasantly surprised, but disappointment, But we're going to get rejected, and we know that. And then finally, resting on your laurels does not exist with a doctoral degree. As doctorally prepared nurses, we are obligated professionally, and I would even go as far as to say morally obligated, that when we have an idea, now you have the knowledge base, the know-how to make change in the profession, and that's what is expected of us. And so that there is no excuse anymore. You don't have that excuse. You can't, well, I don't know how. That excuse left the day you signed up for your first class, right? So no resting on the laurels. All right, so that's the end of the presentation. Let me tell you about this word. This is called, I asked this question, what's your Buddha elephant? Okay? And if you notice over here, what is this picture of? Yeah, it's an elephant. And I have 11 nieces and nephews. I have one son and 11 nieces and nephews. And I have all of my nephews are within 16 months of each other. And so they've grown up like brothers, okay? I've got all the boys at the house constantly. One of those is 11 years old, and he's a type 1 diabetic and has been diagnosed with type 1 diabetes since he was age 3, was when he was initially diagnosed. And I love this kid to death. He's like my kid. And he also had a pretty serious speech impediment when he was growing up, had to go through speech therapy and so forth. But we could always understand everything he was saying. That's how it works. And so somewhere when he was tiny, when he started to talk, we saw this really beautifully decorated elephant. And he was pointing at it, and we said, yes, that's a beautiful elephant. And he said, a Buddha elephant. So it became a Buddha elephant. So everything that was, from that point on, you know how words that kids say stick with you forever, and you have your own language as a mom or a family? So that word, that phrase stuck with us, and everything that was wonderful and fantastic in our family became a Buddha elephant. Okay? So this particular research project has now become my Buddha elephant. And so, I want you to take that away and think, what is your Buddha elephant? What is it? So anyway, that's the secret behind a Buddha elephant. And it's really fun to say, too. People are going to look at you like, are you crazy? That's the end of the presentation that I have. And at this time, just we'll open it up for questions or comments or discussions if anybody has anything.